Filling the chat room out. We are good. Hello, Sandy. Hello, Rajat. Hello, Susan. Okay, now I think we can get moving a little bit here. Okay, first let me come back here and come back here. And we're going to talk about something very, very important. Good evening there, Sandy. Okay, it's about time. We're going to get moving right now. I want to talk about something so important. Vertigo and dizziness. And I just want to talk a little bit and then I'll go over some information with you, but I want you to hear a little bit about this. It's called benign paroxysmal positional vertigo, benign postural vertigo, benign positional vertigo. They use a BPPV. And this is a condition that when a person moves their head kind of upwards, downwards, getting out of bed, going to reach for something down, turns the wrong way, and they start getting this really dizzy, this spinning, this crazy sensation in their mind, and the room starts spinning. And this condition, sometimes you can get nystagmus where the eyes kind of go back and forth like this. They kind of go back and forth because the neurologically, the brain is perceiving something incorrectly, which we'll talk about this. Now, people can get vomiting, people can get dizziness. So this particular situation is something that's very common, and I want to show you a technique hopefully that can help you. This is a great technique, and actually I'm going to show you some great acupressure points for dizziness, nausea, and some vertigo. But this is a false sensation. This is not a real sensation. Things are not really spinning. Things are not really moving. And when people feel this dizziness, they can get this lightheadedness. Even if you don't have this nystagmus of the eyes, even if you don't have this dizziness, you can just kind of feel like you're just not there. You feel like you just feel lightheaded. You just feel kind of woozy. You just feel like things aren't happening the way it should. Now, I want you to understand something, that this is a change in head position. This is a disorder. There's what we call otoconia. Otoconia is these calcium particles that are normally in there, but they're embedded in one part of the inner ear. It's called the utriculonosacule, and they become displaced. And so when they become displaced, they move into another part of the inner ear, all right? And this is usually the posterior semicircular canal. So when people get this, they think right away they have ear infections, they had other conditions going on, but this type of feeling is a spinning feeling, this nausea feeling. I'm hoping that this is all it is with you, because I'm going to show you and I'm going to explain as we go through this particular maneuver on ways to get this extra calcium that's built up in there in the wrong part of the inner ear, and how we can get it to move into the lymph. Because inside the inner ear, it becomes a very, very complex area. And these ear, nose, and throat doctors basically will give you antivert, give you types of medications for dizziness. And I'm hoping that today we can really see miracles. Okay, and I'm going to touch on the pictures in just a second. We're going to move through this pretty quick. I'm not going to spend a lot of time. I just want to just briefly state for the people that just came in, just moving your head in one direction, maybe getting your head off the pillow, tying your shoes, looking, reaching up on the shelf. These particles are displaced from the normal location to form sludge. And usually it's in the posterior semicircular canal. It's one of the canals in the inner ear. And the disorder can be cured by moving your head into certain positions, which I'm about to show you, called Epley's maneuver, to move these crystal-like things out of where they are right now and putting them where they belong. Okay, so that is something that I'm going to touch on right now, and I just hang in there with me, and we're going to move real quick on this. First of all, if you look at this picture up there, you can see the otoconia. Those are the little calcium crystals. They move around. You have hair-like crystals. You have sensory nerve hair cells in there that communicate with the brain, that tell the brain that when something is moving, the brain feels moving. But when something is lodged and it's in the wrong position, the brain is perceiving something different, so it goes to this nystagmus. If you look at my eyes, it's like this. It goes back and forth, back and forth. Things just spin. You get nausea. And this thing people have had for many, many, many months, even years, and no one's really got to the root of it. But this is a technique I'm hoping that you can exactly try, because it can't hurt you. Plus, I'm going to show you some other acupressure points for your nausea in general, which is good to know. So when we look at this right here, we're looking at the loose particles inside the posterior semicircular canal, and we can see those loose particles here. If we come over here to this picture right here, we can see a different picture. Again, those canal particles right there. And the idea of this maneuver is to take those particles where they shouldn't be, that's causing you to have these symptoms, and move them out by positioning of the head. And that's what Epley's maneuver or Epley's test is all about. So what I'm going to do right now is we're going to move on to this particular test right here of the right ear. Now, I really want you to pay attention to this. This is really important. And it's easier to show you pictures and explain it to you than actually do it on myself or do it on someone else, because you can always refer back to this. And this is something really simple to learn. Now, if you are having problems in the right ear, because this is a right-sided ear right here, okay? If you're having problems in the right ear, and you turn your head to the right side and it causes that dizziness, that vertigo, that weird sensation, or that nystagmus in your eye, that is the side that is going to be down first. Now look at in the upper left corner, all right? Basically, if you look down below, the picture below and the picture above, if you look at the first picture above, the person is sitting up. So generally, it looks like he's lying down right there on the top left picture up there in the first view there. He's not. He's sitting up. Now, if you look at the second picture, what you need to do is you'll turn your head 45 degrees to the right, like this, like I am, okay? And then when you're turning your head 45 degrees to the right, you're going to lay back quickly. Now, here's the key. There's two ways to do this. Number one, when a clinician does it, let me back up a second. When a clinician does it, or a therapist or a doctor does it, usually what they do is they put your head past the end of the table and they drop your head like 20 degrees. But in order for you to do it on yourself, you must put a rolled up pillow underneath the back of your shoulders. So when you go back, your head is coming back 20 degrees. So you can keep your head on the table, okay? Like if you look at the view there, keeping your head on the table, put that rolled up pillow or something thick underneath the upper part of the back. And then when you lay back, okay, your head's going to be 45 degrees. And that's the side that you're going to lay back quickly. So you go back and you're going to stay there in that position for about 30 seconds to a minute. And when you lay back, you may feel this dizziness, but it's going to go away. Okay, stay there. And just stay there 30 seconds to a minute. And then what I want you to do after is you're going to turn your head 45 degrees to the left immediately. So you're like this, to the right, laying down, laying back, like I'm laying back. And then you're going to turn your head to the left 45 degrees and stay there. You're not going to get up. So when you're laying on your back with your head 45 degrees to the right, after 30 seconds to a minute, when that vertigo goes away, you're going to turn your head to the left and stay there for 30 seconds to a minute, just like that. That's the third picture there, okay? So you'll stay there for 30 seconds to a minute, turning your head to the left now, and that is really the second part of this. So after that, you're going to lay on your left side. If you look at the fourth picture there, lay on your left side, and you're going to turn your head even more to the left, kind of like where your chin is against your chest, as far as you can turn. And you're going to hold it there in that position, 30 seconds to a minute. And that's the whole procedure. Now, after that, you're going to get up, like the fifth view there. See the guy sitting up all the way to the right. And you're going to get up and you're just going to sit there. Now, an important thing to do when you get up, okay, it's out of focus. Let me see if I can bring it a little more in focus. I know it's, let me see what I can do. I'm going to show you another example, by the way, guys. But let me just do this for you. Maybe this will help you. Is that maybe a little better? Even though I made it a little smaller, okay? And maybe a little bit better there. But anyways, I'm going to explain another view, another example. Okay, so I'm going to review it real quick. Okay, you turn your head to the right. You're having this vertigo. That's the side you're going to treat. That's the side that is going to be up at first. So you're going to turn 45 degrees to the right. You're going to go straight back on your back. hold it there 30 seconds to a minute. If you get the vertigo, stay there. Wait that 30 seconds to a minute. Immediately, turn your head to the left 45 degrees. Hold it there 30 seconds to a minute. You still get the vertigo, hold it there until it goes away. It's going to go away. Then just rotate your body on your left side. See the fourth picture there. And you can even bring your head more to the left and bring it down. Now, 30 seconds to a minute. Now, when you get up, I would like you to keep your head right where it's at. 30 seconds, right here. And then roll yourself up and stay there for about 10 seconds and then just go back normal again. Now, here's the key. The key is you need to keep your head upright for 48 hours. Even if you wear a collar, sleep upright, whatever it is, because that crystal is changing. Let's go to a different picture here. All right, and this will kind of answer your question. I know it's a little complicated, but listen to this video. It's going to be played on YouTube. They're going to put it on my channel after, and you can look at it a couple times. It's a great little chart. Now, this picture here, all right, is a picture. Now, this is a little easier to understand. This picture, okay, shows that this is someone with left vertigo. So basically, if you look at the top picture there, they're sitting up. And then to the right, at like 3 o'clock, the person will turn their head to the left, go straight back, okay? As you see in the third picture, turn the head to the left, and hold it there 30 seconds to a minute. The fourth picture shows it's going to turn your head 45 degrees to the right, 30 seconds to a minute. Now, since they're turning their head to the right, you're going to rotate your body, leave your head where it's at. You could even turn it more to the right, tuck your chin in, because we're doing the opposite, as I told you before. Lay on your right side where the head's like almost face down, like it is. Stay there 30 seconds to a minute, and then leave your head like that. Get up, keep it there, slowly bring it back, and sit down for a couple minutes. That's all. It's a great, great, simple procedure, and I think it will help you, and it can never hurt. I've seen miracles with this. A great, great technique. Okay, the last thing I want to go ahead and touch on two other points, okay, before we call it a night, because I know it's quick. I'll go into a couple questions if you like. This is called P6, pericardium 6. And this pericardium 6, there are two master points that I've been teaching people for many years. This particular point, you would go, if you look at my hand right here, you're going to take 2.5 fingers, 2.5 to 3 fingers. There's 2 fingers from that crease right across here. You're going to go down 2 fingers. It depends upon how big your fingers are. So we say 2.5 to 3 fingers. And you can put your point, you're going to take your thumb, and after 3 finger lengths, you're going to go right in the center of that area. Hold it there about 2 minutes. You can do both of them. Try this sometime. If you get nausea, you get vertigo, hold that point. It's like a magical point. And the last point I want to show you is the pericardium, is the third eye. People have heard about this in acupuncture, acupressure. You're going to go up with the bridge of the noses, and right between the two eyes, between the two eyebrows above the eyes, that is the point. You're going to hold that point just like this. Okay, you can't see my picture here. Give me a second. Let me see what I can do here. Give me 1 second. So I can make this a little bit lower, smaller. Okay. So we're going to go to the top of the bridge of the nose, and right in the crease here, you're going to come up a little bit right between the eyebrows, and that is the third eye point. And you're going to hold that third eye point about 2 minutes, and let me tell you something. It's like a miracle. Okay, so the 2 points again that I want you to remember, you have P6, pericardium 6. You're going to go 2.5, 3 finger lengths from the crease right along the wrist here, and then you're going to go right in the middle. That's the point right there. And the other point, as we said here, just so you remember these 2 points, these are like miracle points when I tell you, is the third eye. Okay, very, very important. Great, great point. Something that I think that would help a lot of people. Very important. So anyways, let's just go ahead and just take a look at the over here in the chat room real quick. Hi, Melissa. What happens when you press the third eye area? It takes away dizziness, takes away vertigo, takes away nausea. There's a lot of cool things that it does. It's a very, very powerful point that people have done very well. In the wrist, the same basic thing. Abby, I've been trying to contact me a long time, 1 year. You can look right here in the chat. I'm going to type it right here for you. Okay. All right, if you go there, right there, you can, same name as here, Motivational Doc. You can check me out over there, and so you can send me the message there. It's the best place to get a hold of me there, because I get a lot on the email, and unfortunately, I can't get to all my emails. I get about 400 a day. Anyways, good morning there, Peter, Michelle. How are you? Janet, nice to have you here. Aurora. That's about it, guys. I just wanted to bring this out to you real quick. And I appreciate you guys being here. And this, I kind of hold the late hours because I get home late. And I said, you know what? This is going to be back on my YouTube channel. They'll put it on probably within the next half hour. You can come back. You can look at this stuff. Share this video. It's a great video. Something to really help a lot of people with dizziness. Natural, safe, without drugs. And I'm hoping it can do something for you. So anyways, guys, good night to you people in the U.S. Good night to those out in Europe, Asia, and across the world. We love you. And we'll be back again soon, okay? Okay, guys, take care.